Okay, in question 3 of in class 4, the fourth project that we do in class together, we're going to look at a healthcare market. We're going to make some simplifying assumptions that won't cloud reality too much. But in this problem, there are assumed 35,000 high-risk Caucasians and 55,000 low-risk Caucasians. Caucasians will purchase insurance when they are indifferent between doing so or not. The yearly earnings of Caucasians is assumed to be 79,000. Medical cost, to fix an ailment, whether it be a surgery or whatnot, we're going to assume is just 19,500 per person. And the probabilities of needing a medical procedure for a high-risk Caucasian and for a low-risk Caucasian are these two values here. So I'm going to go over here to Excel, and I'm going to type in high risk, and I'm typing low risk, and the probability of needing a procedure is 0.075 for the low risk, 1.5 for the high risk, and 0.75 for the low risk. The probability of not getting sick is the complement, 1 minus p. So that's just equal to 1 minus that value up there, and then I'll just drag this across. So this is sick, and this is not sick. Okay, and I'm going to center this so it looks nicer. Okay, and then I need to put in our other variables or other values. I'll call this capital N. The number of high risk, 35,000. The number of low risk is 55,000. And then we need the earnings. We'll call that annual wages, 79,000 for both. And then the cost of getting fixed at the hospital is 19,500 for either one. Okay. Now we want to calculate the expected income of Caucasians who purchase health insurance, right? So we're going to calculate the expected income. Okay. If you don't get sick, that's the probability right there, right? If you don't get sick, so you get your wage and you don't have to pay to get healthy, right? If you do get sick, you got to pay to get fixed, right? So that's why there's a cost there. So what we have to do here for the high risk is we have to take the probability of not getting sick and multiply that by the wage, right? And we don't have to subtract anything off because we don't have to pay for anything because we didn't get sick. Then we have to add that to the probability of needing to get fixed at the hospital times our earnings, and if we get sick, we got to pay for it out of pocket, right? So this is a pre-health insurance outcome. Now for the low risk Caucasians, they can expect $77,537.50 in expected wages. So there's a little bit higher because they have a lower risk of needing to get fixed. Okay. So that's where these answers come from. $77,537.50. And then we have the high risk Caucasian expected income, $76,075, right? Okay, now if insurance companies are free to charge Caucasians different premiums based on their known health status, the following gives us the actuarially fair health insurance premium, HIP. Okay, so we're going to calculate the HIP, the health insurance premium. Okay. So the first part is the probability of not getting sick, right? The probability of not getting sick or needing to get fixed. We're going to multiply that by 0 because we didn't need to get fixed, right? And then we're going to multiply. Then we're going to add that to the probability of getting sick, needing to get fixed, right? Times the cost to get fixed, right? And so the health insurance premium for the high risk is $29,000 or $2,925. That's annual, right? And then if I just drag it over, I can get the health insurance premium for the low risk members of society. So there's a difference, right? There's a difference in health insurance. Okay. So I put those two values in here. All right, so moving on. What is the expected income of Caucasians who purchase health insurance, right? We want to find that out, and we can use this equation down here. This is the expected wage of people who purchase health insurance. So for people who purchase health insurance, given that they purchased health insurance, what is their expected wage, right? So what we're going to do is we're going to take the, because everybody has purchased health insurance, the wage has to be reduced by the health insurance, whether they do not get sick, right? Or it has to be paid whether they do get sick, right? So this is the expected income of Caucasians who purchase health insurance, right? So what we're going to do is now we're going to calculate this thing. So I'm going to copy this into the cell for the two groups of people. Okay, so we got to multiply the probability of not getting sick for the high risk members of society. We're going to multiply that by the annual wage minus the health insurance premium, right? Minus the health insurance premium. And this is for the high risk, right? This is for the high risk. And then we're going to do this too. We're going to add to that the probability that the person does need to get fixed, right? And we're going to multiply that by the wage minus the premium they pay, because they have to pay the premium whether they get sick or not, right? And we end up with the same thing as we had right here, right? We end up with the same thing. Okay. And then if I drag this over, we can calculate the expected annual earnings given that a low-risk person purchases health insurance. And again, it's the same as expected earnings in an economy without insurance. Right. That's the health insurance of, or this is the expected earnings of people who are in a society without health insurance. And this is an economy with a free market insurance. Okay. That's a free market health insurance. Expected earnings, right? So these are the expected earnings of the two types of people when there is no insurance in an economy. And this is what they would be with a market system, right? Okay, so those pairs of numbers are the same. Now let's go down here. Now this would be the efficiency argument, right? This is what typically libertarian and conservative economists would argue, maximize efficiency. There are people on the other side that say, out of fairness, so this is the equity argument, having people paying two different health insurance premiums is just not fair, right? So this kind of goes back to that minimum wage argument we were making a couple weeks ago, or making arguments for price controls, right? So in this situation, we have government essentially setting the health insurance premiums of people in society. Now that is going to have consequences. Are the consequences sufficient to maybe not adopt the policy, right? That's not the purpose of this question, though. All right. Suppose, out of fairness, the government makes it illegal for insurance companies to charge different premiums to different Caucasians. Okay, so what we have to do now is we're going to basically pool everybody together. We're going to put everybody in the same risk pool. Kind of like what's going on with COVID. Everybody's in the same risk pool, right? Young people have very low risk, whereas people with who are of a certain age or older and have different ailments, different health conditions, severe health conditions, they have much higher risk, right? The policies that we've adopted over the last 2 years pool everybody into the same risk pool, right? And you may or may not agree with that. So what we're gonna end up doing here is we're gonna pool everybody in Caucasian. We're gonna create one risk pool, right? All right. So since the number of Caucasians who are expected to need medical procedure equals that value, how do I get this 9,375? Well, what we have to do is we're going to pool everybody, right? We're going to have one risk pool. One risk pool here. Okay, and then the number of people who get sick and the number of people in society, right? So the number of people who we expect to get sick is going to be the probability of getting sick for high-risk people times the number of people who are high risk. And then we're going to add to that the probability of low-risk people times the number of people who are low risk of needing medical treatment. So we end up with 9,375 in this particular economy, right? Now, how many people in society in general? We have 35,000 plus 55,000, right? So there's 90,000 people in this society. What's the probability that person gets sick? Or what's the probability that a person in this one risk pool gets sick? We're going to take the number of people we expect to get sick and divide that by the number of people in the society. And notice the probability of being, the pooled probability is between these two probabilities. And it's closer to the low risk because there's more low risk people, right? So that's the probability of being sick. And it's the pooled probability, right? The number of people not expected to need a medical procedure, we'll have to insert a row here. Not sick is just the difference between these two, right? It's just the difference between these two. Okay, so that explains that number. This is inserted into here. This probability, 4 decimal places though, so let's drop this down to 4 decimal places. So we're going to copy that into here. Now we got to calculate, how do I get a per month actually fair health insurance premium for this one pool, right? I got to go back to this equation. Remember, now we only have one pool, right? So all I have to do, well, what I'll do is I'll do this. This is the pooled health insurance premium, right? We got 1 minus, that right there is the probability that people in the pool will not get sick, right? And we're going to multiply that by 0 because they didn't get sick and therefore they didn't need any money to pay for something they didn't get, right? Then we're going to add to that the probability of getting sick times the medical cost, right? Times medical cost. So the pooled health insurance premium is $2,031.25. This is the annual, right? Annual. The annual premium. And notice that it is between these two. So this kind of policy that mandates that people all pay the same health insurance premium, because it's unfair to charge groups of people different health insurance premiums. It ends up being a price ceiling for high-risk people. The high-risk people aren't going to pay that. They're going to pay this, right? And they'll be happy to pay that. But it ends up being a price floor for the low-risk people in society. So this is more than what they were willing to pay, right? On an annual basis, right? Okay, so let's calculate the monthly premium, right? Because I asked for the monthly premium. So all we have to do is divide that by 12. Okay, so that's the monthly health insurance premium. Let me change it to 2 decimal places. Okay, that's where I got this value right here, right? The monthly health insurance premium. Okay. So this is going to end up, this is the number of people insured, right? This exceeds what low-risk people are willing to pay. So 0 people will be insured who are of low risk, right? Because this annual premium is less than that annual premium, all of the high-risk people will want to insure. Right? These are the people that want to insure. At those premiums, right? At that one premium. At that fair premium, right? So 0 low-risk Caucasians are going to buy health insurance. 35,000 high-risk Caucasians are going to buy health insurance. Now, what do the insurance companies witness in terms of profit? What's going to be their expected profit with these two health insurance, with this one health insurance premium that they have to charge to 2 different pools, right? Now, since nobody in the low risk group insures, the probability of getting sick is not that pooled probability. The probability of getting sick is the 0.15, right? Because there are 0 people from the lower risk group who are buying insurance at what they consider to be a high price. So they're now uninsured. These people are insured, right? Because that artificially lowered price is lower than what they would have been willing to pay, right? So this means although the premium is calculated based on this pooled probability, right? The reality is that nobody who is low risk is going to pay that health insurance premium. So the total number of people who end up being insured are just the high risk people in society, right? So that's why the probability of the real probability of needing a procedure is 0.15, right? That's the risk profile of the high risk. That's the probability of getting sick of the high risk profile, right? So now we're going to calculate the expected profit of the health insurance company. The expected profit of the health insurance company So the expected profit is calculated by taking the probability of people not getting sick in this 35,000 pool of high risk citizens. It's that 0.85 times the health insurance premium that they receive. This is what they receive minus, because none of these people got sick, there's no cost to fix them, right? But then we have the people who do get sick, right? The probability that they get sick is 0.15. We have to multiply that by the health insurance premium. Oop, this is the health insurance premium right here. The fair health insurance premium, right? So let's just review that here real quick. We have the probability of these 35,000 people not getting sick, right? Times the difference between what the health insurance company receives in terms of revenue per person minus the expenditure for these people who do not get sick. They don't get sick, so there's nothing to pay, right? There's no procedure to pay for because the procedure wasn't done. Okay, so then now we have the other side of it, right? We have this probability of people in this 35,000 person pool who are getting sick, right? And then we got to from these people, the company has collected a health insurance premium, right? But they've had to pay this cost to get the people fixed, right? So when I hit enter here, we see that the insurance company is making a negative profit. When government sets the health insurance premium at this quote unquote fair level, it prices out the low risk members of society. So the only people who end up buying the insurance are the high risk people. And that results in the insurance company losing money and going out of business, right? So if the insurance companies cannot charge different prices to different risk pools, what will end up happening is that 0 people will be insured. This is the actual number of people who will be insured. We already know that 0 low risk people are insured. Although the high risk people want to be insured, there's no insurance company to insure them, right? So 0 people will end up getting insured, right? So the income tax, okay, so to avoid this consequence, right? To avoid 0 people being insured, the Caucasian government may mandate all citizens to buy insurance. If they don't buy insurance, they'll have to pay a fine payable via an income tax penalty. If the income tax penalty is less than the actual cost of health insurance, right? Low-risk Caucasians are willing to pay, 0 of them will buy the insurance. So if the penalty is less than the annual cost of health insurance that the low-risk Caucasians are willing to pay, 0 of them will still be buying health insurance. But the high-risk Caucasians, the amount they're willing to pay for insurance exceeds what is being charged. So naturally, they want to be insured, right? Naturally, they want to be insured. Now, in order for these 35,000 people to be insured, right, government will need to subsidize these companies, right? So the companies will need a subsidy, a government subsidy to stay in business. There's a government subsidy. The expected loss is that, so the subsidy needs to be at least this, right, in absolute value. We're going to multiply that by the 35,000 people who want to be insured, right? So the subsidy, we'll change this to an absolute value. the subsidy ends up being that, but I want you to report it in millions using 0 decimal places. So this is the number of dollars of the subsidy, right? That's the number of dollars of the subsidy. But I want in terms of millions, so I have to divide it by a million. Whoops. Divide by 1, 1, 2, 3, 1, 2, 3. And I want no decimal places here. So $31 million. That's where they got $31 million, though. All right. So in order for these 35,000 people who want the insurance, the government has to subsidize the insurance companies, right? And those subsidies will come out of the fines that the low risk people are willing to pay because the fine might be set arbitrarily low, right? So they're paying the fine instead of buying the health insurance because the fine is cheaper than the health insurance, and they're just making the bet they're not going to get sick, right? Okay. Now suppose this ends up creating a massive budget deficit for Caucasia, and people are unhappy with it. There's only one health insurance company, and that one health insurance company has a monopoly in this market. The health insurance company is getting a huge subsidy to provide health insurance to the high-risk members of society. Without that subsidy, they would go out of business. So there's no other insurance company stepping up to offer insurance either. So suppose members of society are fed up with the system. So they elect people who decide that insurance companies can be free to charge different premiums to different risk pools, right? They're allowed to gather data on potential customers, like correlates of healthcare, which include age, race, sex, location, BMI, smoking status. They're not forced to cover pre-existing conditions and allowed to offer policies that appeal to high-risk Caucasians, low deductible, low copay, high price insurance policies, and low-risk Caucasians, low price, high deductible, catastrophic coverage, right? The choices that customers make reveal who they are, right? So if you're a person who is in a high-risk group and you want to get health insurance from a company, you call them up and you ask them a lot of questions about what doctors are included in network, what procedures are covered. You ask them a lot of different questions. You don't want to pay a low. You want a low deductible and you want low copays because you plan to use insurance a lot. Well, they're going to give you a high price insurance policy, right? And this particular person is willing to pay up to $29.25 per year, right? Per year. That's how much they're willing to pay up to, right? So per month, they're willing to pay up to $243.75, right? That's where this comes from. So this is a high price, low deductible, low copay insurance policy. A relatively healthy person, low risk of needing medical service, calls the insurance company up and says, yeah, what's your lowest price insurance policy? And the person says, well, it does have a high deductible and it has, and it's mostly a catastrophic coverage plan. And so the person agrees to it because maybe that premium is priced at this value, right? Annually. Remember, this is the amount, the most they're willing to pay for health insurance, right? For the low risk people. So per month, that's only $121.85 or 88 cents, right? So I copied this value into here. I copied this value into here. Now at these premiums, remember the assumption was if the person's indifferent, they'll go and pull the trigger and have the insurance, right? So what that means is everybody's insured. Low risk people are insured and high-risk people are insured, right? So this right here is the efficiency argument, giving people what they want, right? The kinds of coverage they want. The two groups of people want two different kinds of health insurance policies. And for that reason, the prices are different. And they're different because of the probabilities of them getting sick and how those probabilities are factored into whether the insurance company makes money or loses money. If the insurance company loses money in a market system, they're not going to be in the market very long. They're going to have to up their premium, right? And if they up their premium too much, they might lose customers, right? People might not choose to insure. That's the efficiency argument. Up here is the equity argument, right? And the equity argument is going to have to include, because nobody ends up being insured, right? When you cap the premium of a high-risk individual, and you put set a floor on the low-risk individual, when that's all you do, you end up getting zero people insured. So the equity argument is going to need additional interventions. And those interventions may include a mandate insurance that citizens buy insurance. And that mandate might include a penalty, a fine that is paid via income taxes, right? So, and it's going to also probably have to include a subsidy to the health insurance companies. Otherwise, they'll go out of business, right? So you have the equity argument up here, and you have the efficiency argument down there.